When you're treating a person with Alzheimer's, you're also treating their caregiver, right? So there's always the dyad of the caregiver, the spouse, the daughter, the son, a home aide. There's always, almost always a caregiver. It's very hard for a person with Alzheimer's to live alone and not have any services. There's no magic bullet. I mean, we can write prescriptions like we can for hypertension, but we don't have an easy biomarker like cholesterol or hemoglobin A1C. Oh, your hemoglobin A1C is 7.2. I'm going to give you this drug. Come back and see me in a month. Okay, now it's 6.8. You know, everything's wonderful. Because we're measuring cognition as the primary outcome and function. And it's hard. There's no number, right? So it takes an interview or a mini mental exam or some kind of gestalt about how a patient's doing. They need education and counseling. That takes a long time. Physicians aren't paid. There's reimbursement problems for payment for a physician to spend an hour with a patient and literally end up, after taxes and overhead and rent, to come home with 30, 40 bucks because all these people have Medicare. So there's a lot of disincentives for doctors to spend time with education and counseling and arranging services and long-term care when they really, if as a geriatrician, for example, if that's all I did, I wouldn't be able to pay the rent. So, you know, I really think that the problem is sort of structural. I hope that with the way medicine is changing, that maybe the financial incentives can change so that doctors can take better care of Alzheimer patients. But right now, you know, I get patients referred to me, you know, who are seeing neurologists or primary care doctors at some of the major academic medical centers, and they're just not getting care. And I like to quote Hippocrates, basically, and he said, you know, like 2,500 years ago, whenever it was, he said the role of the physician is sometimes to treat and often to relieve pain, but always to comfort. And these patients are suffering. You know, most of them are not having a good time. You know, it's a long day, and caregivers need really a lot of education and counseling and how to deal with this thing, because it, you know, these are people, the caregivers are often 75, 80 years old, taking care of someone who's totally dependent or keeps asking them 5 times every minute, you know, where are we going later? And drives you crazy. You know, the challenges are enormous. So I think for physicians, this is a very, very difficult illness, and we haven't figured out the right paradigm for care at this point.